Hey everyone, this is Oscar Stroini, and I am going to be running you guys through a really quick presentation on knee injury. This is for a human biomechanics class at Michigan Tech, and let's just jump right into it. The knee is made up of four bones: the femur, the patella or kneecap, the fibula, and the tibia. Holding these four bones together are four main ligaments: the medial collateral ligament, the posterior cruciate ligament, anterior cruciate ligament, and the lateral collateral ligament. Interfacing between the bones is cartilage. The articular cartilage on the femur glides on the lateral meniscus and medial meniscus of the tibia. Damage to the knee can occur in many different ways. First, we're going to be looking at ligament damage. The ACL, or anterior cruciate ligament, is most commonly injured through twisting of the knee. This happens in sports such as football or soccer, where the player is undergoing rapid direction changes. It is usually accompanied by a popping sound, followed by intense pain and swelling. The posterior cruciate ligament is normally injured through hyperextension of the knee. This can be caused by an impact to the front of the knee, causing the knee to buckle backwards, tearing the posterior cruciate ligament. The medial collateral ligament is most commonly injured from an outside impact. The MCL is on the inside of the knee, and an impact on the outside of the knee causes the bones to separate slightly on the inside, tearing the MCL. The LCL, or lateral collateral ligament, is just the opposite. It lies on the outside of the knee, and an inside impact can aggravate this injury, again, usually followed by a popping sound, intense pain, and swelling. The next type of injury we are going to be looking at are injuries to the bones in the knee. A patellar fracture involves a cracked kneecap. These can range in severity from hairline cracks to the rather gruesome illustration shown here of a completely destroyed kneecap. An osteochondral fracture occurs under the same conditions as an ACL tear, namely twisting and or high impact situations, and just involves damage to the cartilage and underlying bone on the head of the femur. Again, ranging in severity from something that can take care of itself through the body's normal healing processes to an injury where the doctor has to go in and remove chunks of bone and or cartilage, immobilize the knee, and allow the natural healing to take place. A femoral fracture, pretty straightforward, happens at the head of the femur, ranging in severity from compound to hairline. Straightforward, just like normal bone breaks. Same for fibular fractures, usually occurs during high impact, the femur coming down on the fibula, cracking it down the middle most often. A tibial fracture is a little bit different and occurs normally when the LCL, lateral collateral ligament, pulls a chunk of the bone out of the tibia instead of snapping itself. These are quite common and are very painful. Again, popping sound, swelling, nearly instantaneous immobilization. The next thing at is cartilage damage. And this usually happens in conjunction with ligament tears and or fractures or breaks in the knee. First is damage to the meniscus. The meniscus is essentially a cartilage pad that cushions and holds your femur in place. Damage usually occurs because of twisting with a planted foot, high-speed impacts, anything like that. Something unique about cartilage is that there's not a whole lot of blood flow to it. You can see the red zone and the white zone. Red zone is a part of the cartilage that does have a small amount of blood flow and does have some capability to repair itself. The white zone, where you can see the longitudinal tear, the oblique tear, and the radial tear in the lower part of the picture, those injuries will not typically heal themselves. They require either medical intervention, arthroscopy, something like that, or just complete removal. It's not unheard of to completely remove a torn part of the meniscus just so it doesn't get lodged somewhere that it shouldn't and cause problems later on. Articular cartilage damage can occur on the head of the femur as well through high impact and degenerative wear. Cartilage can also deteriorate with time. In order to stay healthy, it needs to stay moving so it doesn't dry out. The damage can range in severity from small abrasions on the surface to large patches of missing cartilage with damage to the bone underneath, similar to an osteochondral fracture. There are several options for the treatment of different types of damage to the knee. Probably the most common one is knee arthroscopy. It's a less invasive procedure instead of open knee surgery where they make a large incision. This involves several small incisions, and the surgeon would use a viewing scope to perform the surgery internally, whether it be a ligament repair, meniscus removal, anything of that sort. The procedure essentially starts with a small incision in which the knee is then pumped full of saline solution to kind of spread everything out and make it a little bit easier to work with. The camera is then inserted, and the trimming instrument, or whatever drill the surgeon might be using depending on the procedure, and the surgery is carried out generally outpatient, short period of immobilization, much less damaging and invasive than the old technique of opening up the knee and just scrambling everything up. Very common. It's a very good option for many injuries. Another option is simple rehabilitation, strengthening of the knee and the surrounding ligaments, muscles, everything like that, in order to either bring a ligament back into use, get it going again, or strengthening other ones to make up for a missing. A third option involves complete knee replacement. This is relatively common, but only for severe degeneration or injuries of the knee. All of these options have their own sets of unique advantages and disadvantages. However, they all do share one thing in common, and that is they aren't perfect. There are usually complications, and the knee rarely returns to its full usability prior to whatever traumatic injury or degeneration happened. They are starting to come up with solutions to that now, though. Using nanotechnology integrated with biology, they are beginning to develop nanofiber scaffolds that can actually promote nerve regrowth, promote cell growth, and form a scaffold for the rebuilding of collagen in joints and cartilage. This is an image of carbon nanotubes interfacing with a collagen cell known as a chondrocyte. Really quickly, we're just going to zoom in right here. Got a pretty cool picture. This is a scanning electron microscope image of actual collagen cartilage fibers in a knee joint. You can see in the lower left the scale is around 200 nanometers, so this is a very, very complex, tiny structure that is incredibly difficult to replicate. There are no blood vessels in this either, which means biologically it doesn't have energy flowing to it to make it repair itself. A solution to that is to inject a gel containing the nanofiber scaffolds into a damaged area of the joint, and they can actually interface with the bone and cartilage and give a template for the body to start regrowing itself around it. This is relatively new technology. They're undergoing clinical trials in animals right now. It looks very, very promising and has the potential to not only help regrow cartilage, but perhaps regrow it thicker and stronger than it was originally. So some very cool technology coming out here in the near future. That's all I have for you guys. Thanks for watching. Leave a comment. Suggestions are always welcome. Thanks.